Hi everyone, I am Shahan Layek. Welcome back to my channel, and in this video I will be talking about Pseudotumor Cerebri. So this is one of the very important topic for you, and it is repeatedly asked in NEET PG, DNB examination, and also sometimes asked in USMLE and PLAB examination. So what is Pseudotumor Cerebri? Remember the name Pseudotumor Cerebri. Basically, it is benign intracranial hypertension. It is benign intracranial hypertension. Benign intracranial hypertension. Very important thing about this disease is it looks like you are having a tumor. So it looks like you got a tumor, but actually you are not having any brain tumor. Actually you are not having any kind of brain tumor. Then what has happened? Actually your brain intracranial pressure, ICP, has been increased. Actually what happened? The intracranial pressure of your brain has been increased, and that is known as Pseudotumor Cerebri. That is known as Pseudotumor Cerebri. Now basically what happens? How you actually got this? Basically, this is due to, what is the cause? Let us learn about it. The cause is outdated tetracycline. Outdated tetracycline. If you have taken outdated tetracycline, and if you have taken too much of vitamin A, then you will have increased intracranial pressure. You will have increased intracranial pressure, and that is known as Pseudotumor Cerebri. You can understand it from the name itself. The name says pseudo. Pseudo means false. It is not true. The tumor is not true. So it is pseudotumor. It looks like you are having a tumor in your brain, but actually it doesn't. Actually you are having increased intracranial pressure, increased ICP in your brain because of taking outdated tetracycline and too much of vitamin A. So all these drugs which you have taken has caused increased in intracranial pressure, and that is known as Pseudotumor Cerebri, and it is also known as benign intracranial hypertension. It is also known as benign intracranial hypertension. Benign intracranial hypertension. Benign. It is a benign disease. Intracranial. It is not. It is inside the brain, inside the cranial cavity, and that is why it is known as intracranial and hypertension. Increase in the pressure. So it is intracranial pressure increase, ICP increase. So basically what do you get? What is the symptom of this? You have to understand it. Basically you get the symptoms which are very important. The patients present with nausea or vomiting. The patient also presents with dizziness, and the patient sometimes present with severe headache, And this headache, sometimes they also tell that this headache is localized behind the eye. Behind the eye. So the patient is presenting with nausea, vomiting, dizziness, severe headache, and another very important characteristics is vision loss. Either the patient present with vision loss or double vision. Basically, this is due to hypervitaminosis, that is increased taking of vitamin A. I told you two important things why this disease is caused. If you take outdated tetracycline and if you take too much of vitamin A. So too much of vitamin A can cause vision loss or double vision. So always remember this. What is basically the cause? The cause is not too much clear. It is idiopathic, but it is thought that this is due to taking of outdated tetracycline and too much of vitamin A. So basically this can be found in both adult and children. But it has been found that it is more common, sometimes these are also asked in MCQ, more common in obese woman, obese female. Okay, it is more common in obese female of childbearing age. Okay, more common in obese woman with childbearing age. So what is the risk factor? Can you tell what is the risk factor for this disease? What is the risk factor for the pseudotumor cerebri? The risk factor is obesity. If you are having obesity, then you are having more chance of having increased in your intracranial pressure, increased in your intracranial hypertension. So you may get pseudotumor cerebri. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel for getting many more videos like this. Thank you so much for watching. Have a nice day. Bye bye.